Lesion-symptom mapping is a powerful tool to localize brain functions by studying patients with brain lesions. An important step involves image processing, including lesion segmentation and registration to standard space.
This protocol describes a unified framework that works with all structural imaging modalities, providing a consistent output of lesions in standard space for use in lesion symptom mapping studies.
The lesions must be transformed to standard space to allow for comparisons across subjects. Each patient's brain must be spatially aligned to correct for differences in brain size and shape.
While using this method, it helps to see how each step should be performed, rather than following written instructions alone. It also requires a good understanding of brain images, which makes a visual demonstration useful.
This protocol describes how to perform the processing steps required for lesion symptom mapping. Once the lesion maps are registered to standard space, lesion symptom mapping can be performed on large groups of patients. When all the lesion maps are transformed to standard space, each voxel represents the same brain region across subjects. This allows for statistical analyses to be performed, for example, to test if the presence of a lesion in a particular voxel is associated with a cognitive deficit. Begin by collecting brain CT or MRI scans of patients with ischemic stroke. Most scanners have the scans as DICOM files that can be copied to a hard disk or server. Collect the clinical variables in a data file by making separate rows for each case and columns for each clinical variable. For infarct segmentation, include at least the date of stroke and the date of